Hello everyone, I'm Tanya Rivera. March is Colorectal Cancer Awareness Month. Doctors say while colon cancer is common, when caught early, it is 90% treatable. WFMY News 2's Sydney Moore spoke with one woman on how early detection saved her life and why she's spreading the word to others.
For 75-year-old Carol Medlin, walking trails aren't just a way to get exercise. They're her daily escape.
And I come with friends sometimes and come by myself.
For 2 decades, Medlin has made the trails at Guilford Courthouse National Military Park her second home.
I've been here every day where the weather is good. When it's not, I walk on my treadmill at home.
But in January, a sudden and unexpected challenge threatened to take away her walks, a cancer diagnosis, one she never saw coming.
That was one of the things I worried about the most.
Medlin's stage 1 colon cancer was discovered after a routine colonoscopy.
I had my first one when I was 55, no polyps, no problem. I had my second one when I was 65, no polyps, no problem. And this might have been my last one. I'm 75 and I even joked that this might be it.
But this time the results were far from what she had expected.
And it turned out that my doctor, Dr. Pyrtle, found 5 polyps in my colon.
Suddenly she was faced with a tough decision, surgery or wait and risk the cancer spreading.
It was awful. I was so upset, yeah. It almost makes me cry to think about what it turned out not to be so bad, but that's not what you think when you're told you have a cancerous polyp and you're going to have surgery.
Before her diagnosis, Medlin felt perfectly healthy.
0 symptoms. Healthy. I stay fit, I work out, you know, I'm in great shape for the shape I'm in.
Dr. J. Pyrtle with Cone Health says colon cancer is common, but if caught early, it's 90% treatable.
We're not fully sure what leads to colon cancer, but we know that a healthy diet, avoiding smoking, focusing on a high fiber, high protein, but low processed food diet can make a difference.
He says it's recommended people begin getting colonoscopies at age 45.
It used to be 50 years old, but several years ago, because of that fact, average risk individuals are recommended to start screening at 45.
Absolutely.
And then you get screening every 10 years if your colonoscopy or screening colonoscopy is normal.
Now cancer-free, Medlin is back to living her life one step at a time.
The surgery went smooth as silk.
Thanks to a successful surgery performed by Cone Health doctors.
And I'm building back up to doing a little quicker walks.
Medlin is also working on improving her diet, focusing on healthier choices.
And I just found out that I can start back eating my regular diet and retrain my colon.
As she takes it day by day, Medlin has one message for others. Get screened. Don't wait until it's too late. In Guilford County, Sydney Moore, WFMY News 2.
That colonoscopy screening literally saved her life and could save yours as well. So we're going to talk a little bit more about this with Dr. J. Pyrtle, who you just heard from, Cone Health LeBauer Gastroenterology and Division Chief for Cone Health GI Services. All right, so let's just talk about, folks have heard the term colonoscopy. Let's talk about why it is so important in preventing colorectal cancer.
Yeah, so thanks for having me. Colonoscopy is a medical procedure where a flexible tube with a light and a camera is passed through the colon or large intestine and rectum to look for polyps, which are abnormal growths that can be precursors to colon cancer, and allow us to find those and remove them to prevent trouble.
All right, so now let's kind of talk about who should have a colonoscopy, when they should have it, what the recommended age groups are.
So the recommended age group is for all Americans. It's everyone starting at age 45, and that's average risk patients with no symptoms. And that's so therefore it's a screening test. That changes a little bit if you have family history or other factors that we can talk about, a bit later.
But once you hit 45, everyone should be getting this screening.
Yes, everyone. A screening is recommended for all adults at age 45.
And it's
Yes.
usually every 10 years.
every 10 years if the test is normal. So that also depends on the screening test that you pick. If you pick colonoscopy and it's normal, it's every 10 years. If you pick a stool-based test, then it's shorter, the interval shortens down, so because those are a little bit less accurate.
Okay, that was going to be my next question, because a lot of people say, well, I don't want to get the colonoscopy just yet. I want something a little bit less invasive. What about that stool test? Is it a good alternative, or do people still need to get that colonoscopy?
It certainly can be a good alternative. Colonoscopy is the gold standard, and it is considered the most effective screening test. It has the highest sensitivity at finding polyps and cancers earlier. The two stool-based tests are basically FIT testing, which looks for microscopic blood, and then Cologuard, which looks for DNA changes of polyps.
Okay.
And those polyps,
Go ahead.
those changes are found in our stool, and that's how that test picks that up. So FIT testing is recommended annually, and Cologuard is recommended every 3 years.
Okay, and then from there, you may still have to get that colonoscopy if something comes from that
Correct.
test.
So if either of those would be positive, then that would lead to a colonoscopy, yes.
All right, so we established that 45 is the age for every single adult to get a colonoscopy. When does family history impact a change in the age of when someone should start screening for colon cancer?
So for patients with family history, the test often starts earlier, particularly if your family member had colon cancer before age 60. So if it's a first-degree relative, like a parent or a sibling or a child, then the test starts at age 40. It also starts 10 years before that first-degree relative if it's before, age 50. And so it would go 10 years back from there. And then multiple second-degree relatives. So if you had more than one grandparent or aunt or uncle, then the test also kind of follows the elevated risk screening guidelines.
Okay, and then you would need to get your screening earlier. So we said 45 is the date, the average age, of when you should start getting your test. But let's talk about what the signs and symptoms of colorectal cancer are, no matter what age you are. What should we be looking out for?
So again, this is screening, so it's meant to detect a problem before it gets to a point that it is a problem. And sometimes, unfortunately, there's really no symptoms of an early colon cancer, and so that's another reason it's so important to have your screening. But for those that do develop symptoms, then you may have abdominal pain. You may notice a change in the characteristics of your stool, a change in the shape or the consistency. You could see blood in your stool, or you may have unexpected weight loss.
Okay, let's talk about a few myths or fears about colonoscopies that we can just clear up.
Yeah, I think one of them is that colonoscopy is painful. And the truth is that this is a sedated exam, and we do everything we can to ensure that there's minimal discomfort, and very often there's no discomfort at all. So many of our patients wake up and aren't even sure that we've started yet. And so that's the nice part, that this is not a painful test.
Right.
Another one is that the bowel prep is terrible or too difficult, and it's generally manageable. We have different solutions. There's even a pill-based prep now. I did my colonoscopy a couple months ago, which gives away my age, I guess, but it wasn't so bad. And the prep was effective. It does its job, and really the prep's so important, and so that we can see. We really can't find what we can't see, and so getting through the prep is just very important. Mm-hmm. Another myth is that if you don't have symptoms, that you don't need a colonoscopy, and it's in fact quite the opposite. You want a colonoscopy before you have symptoms, as we talked about earlier. And then others, that it's too expensive or too time consuming. And so very often colonoscopy is well covered by most insurance, which makes it manageable. The test itself takes 30 minutes or less of actual sedation time. And you're generally off work the day of the test. You do not have to be off work the day before or the day after. And so a lot of those things make the test, really easier than one expects.
Yeah, I would agree with all of those things. I had mine this past year as well, so I think all of those things that you hit. I mean, I'm going to say when they hear it from the doctor, one thing; when they hear it from a normal person, too, and say, "Yep, that's true." All of those things that he said are right. All right. So when we're doing that pre-prep stuff for the colonoscopy, let's talk about some do's and don'ts that could help with that process.
Yeah, so usually about a week before, 5 to 7 days before the colonoscopy, you start to reduce the fiber in your diet. So you eat less roughage, But really, it's the day before that you do clear liquids, and that doesn't mean that you can't have any calories. It just means that you can have solid foods. The bowel prep itself, which is if you pick the solution version, which is most, starts in the evening around 6 p.m. the day before your colonoscopy. You can still have clear liquids that entire day and evening. And then early on the morning of your test, you do a second half of the bowel prep. And then 3 hours before, you don't have anything else to drink until after the procedure. Then generally when you wake up, you're able to go eat and drink as normally.
Okay. In addition to getting the colonoscopy, what kind of lifestyle changes should we all be making to help lower our risk of colon cancer?
So certainly avoiding tobacco, not smoking is incredibly important. Eating a high fiber diet with fresh fruits and vegetables, limiting processed meats. We do have more data that processed meats may be involved in the genesis of polyps and colon cancer. Limiting alcohol, exercising regularly, and trying to maintain a healthy weight. Those are general, that's for more things than just colon cancer, but those are the things we talk about.
General good health for sure. All right, so for folks, besides age, besides family history, are there other risk factors for colon cancer that we should be aware of?
Some of them are the lifestyle things that we just talked about. So smokers are at higher risk, patients that are overweight or obese, patients with a long history of heavy alcohol intake. Diabetics, type 2 diabetics particularly, are at slightly increased risk of colon cancer. Also patients with long-standing inflammatory bowel disease, Crohn's disease, colitis, that affects the risk of the disease. Possibly low vitamin D levels, and then race. American Indians and African Americans have a slightly higher risk of colon cancer over their lifetime.
Okay. We've kind of gone over that the screening, that we need to start it at 45, that it really takes that 30 minutes for the actual procedure itself, that the next day after the screening you can go to work and things are just fine. So finally, as we're kind of wrapping things up here, for someone who has been putting off their colonoscopy, what is your message to them right now?
Really, it's to be proactive and try to get over the fear of talking to your doctor about it. It's important. It truly can save your life. Colon cancer is the third most common cancer in America, and it is really preventable. And truly the best screening test of all that we talked about is the one that you will do. So pick one, and just do it.
I mean, and to a testament, any of you who watch WFMY News 2, you know our own Julie Luck. She went through this. She got that routine colonoscopy and found out that she had cancer. And so she was able to be a cancer survivor. And we're just so thankful that she was able to find it early, just like you were saying.
Yes.
All right, so if you need to send this to someone in your family, someone that is a friend of yours who has been kind of putting this off, we want you to be able to send this interview to them. It is going to be in the To Your Wellbeing section of our website.